it's a guaranteed way to save money. I mean, you save somewhere around 30% of everything you put aside and pay through the FSA. So only 20% of all federal employees have an FSA. And again, it should be 100, because even if you're in a high deductible health plan where you're not allowed to have an HSA and an FSA, you can still take out what's called a limited expense FSA for dental and vision.
Hi, folks. This is Love Rutledge, host of the FedUpward Podcast, and I'm joined by Kevin Moss from Consumers Checkbook, who's going to give us the rundown on what we need to know this year before we make our federal employee healthcare benefit selections as open season kicks off. Kevin, welcome back to the podcast.
Thanks, Love. Thanks for having me. Good to see you again.
Likewise. And so you are one of the most knowledgeable people out there on all of the federal health plans and the changes that have happened since last year. So tell us everything we need to know.
Okay. Well, I'll do my best. I think there's one really big story, and that's premium increase. So if you haven't heard, it's going up, and it's a big time increase, 13.5%. So this is the biggest increase probably in the last couple of decades. It's kind of hard to see this over the course of the last 20 years, but we know, just compared to last year, we were around, I think, like 7.8% the year before, 8.2%. And prior to that, we were in the kind of mid-single digits. So this one is a really big one. And, it is an average. It's the average enrollee share, 13.5%. It doesn't necessarily mean that your plan actually went up that much. There was actually 28 plans for 2025 that the premiums are going down. 5 plans, the premium staying the same, and then 69 plans premiums going up, but below that 13.5%. But in 42 plans, it's actually above 13.5%. So you may find out that your plan has actually gone up even above the 13.5%. And depending upon which plan you're in, the impact of this, and also your enrollment type, if you're self-only, is going to be different than if you're paying a self and family premium. But this is a for sure expense, and there's no getting away from it. You have to pay the premium in order to be enrolled in the health insurance plan. And so depending upon where you are in that increase will depend on, how big a deal this is going to be for you. But I pulled out 2 extremes. So one is Presbyterian Health Plan in New Mexico. Their premium's actually going down 23%. That's going to save self-only enrollees $732 next year. But there's a plan in the Midwest. It's called Health Alliance HMO. Their premium's going up 66%. That's going to cost self-only enrollees $2,222 more. So this is something that is probably changed in almost all cases. And even if you've been relatively pleased in your plan over the last couple of years, and you think that you may want to stay, you do need to know how this is going to impact you. The best place to look is the official FEHB plan brochure. If you have it, the last page of any FEHB plan brochure will tell you the premiums for next year. They'll break out the government share and the enrollee share. And then you'll be able to see what that premium is going to be. And also there's the OPM plan comparison tool. There's also Checkbook's Guide to Health Plans, and we'll show you how those premiums are changing too.
Yeah. So a couple of things. So first, let's dig into your tool, make sure people know what that is and where they can go to find it, because it is an incredible resource at a very, very low price point.
Yeah. I don't want it to be talking just about our plan comparison tool, but Love, if you've given me the chance, then I will say it's at guidetohealthplans.org. There's a few dozen agencies that provide free access. If you go there, just say, does my agency provide free access? You'll be able to see which agencies provide free access. And like we have in the last couple of years, your listeners can use promo code FedUpward, save 20%. I think out the door, it costs you a little bit less than $13. And what we do that can't be found anywhere else, we rank the plans on estimated yearly costs. So it's not just the premium that you have to worry about. It's also your out-of-pocket costs. And so you really have to look at both. That's the total cost. And OPM, a few weeks ago, they released their federal benefits survey from 2023. 81% of all federal employees who responded to that survey said total cost was the number one thing that they were looking at when thinking about a health plan. And
Yeah.
you can find those on our plan comparison tool. We ask you a little bit of information that we use to help us kind of refine it a little bit. Age of the primary insured, how large your family is, any expected, and what your expected healthcare usage is. Then we're able to model those costs against other families like yours, producing a benchmark ranking of the plans from least to most expensive. And I think it's a really great resource to help folks narrow down their choices. Choice is good generally, but there's a lot of plans, and depending upon where you live, there could be upwards of almost like 30 plans, like in the DC area, that have open enrollment. And so being able to narrow down a couple dozen or so plans to just 3 or 4, I think is really helpful. And the yearly cost estimate found in our tool will help folks do that.
Okay, awesome. So now that we have gotten the mechanics out of the way, and I will make sure that I have those in the notes available for listeners and viewers, let's get back to the details that you think are the most interesting changes from last year. Okay. Before we jump in, though, I want to make sure that you have an opportunity to say what you said last year, which is even if you're really happy with your plan, you should still be kind of reshopping to make sure that it's still the best fit for you.
Yeah, I think that's something you got to do every year. So one is how the premium's changing. 2, what else is changing in my plan? And the best place to go is section 2 of the official plan brochure. That's the section where the plan says, these are the important changes next year in this plan. That is where you can find out if a benefit has been removed, or it's been altered, or whether a new benefit has been added. So a couple of examples, highlights from that. One of OPM's initiatives for 2025, greater maternal benefits. So they want plans to do a better job of expanding maternal benefits to start including things like midwives, doulas, and delivery at birthing centers. And GEHA plans, for example, have added doula coverage for 2025. So if you went to section 2, you would find out that if you were in a GEHA plan, that they've now added doula coverage. That may be something that you might want to know about. But it's also really important to find out if benefits that you use are changing. And next year, we'll give this example because we know that there are a lot of federal employees and annuitants on Blue Cross plans. Blue Cross Basic has some significant benefit changes. Their catastrophic limit is going up. Their specialist visit copay is going up. Inpatient hospital, outpatient hospitals going up, as well as brand name prescription drugs. So, not only possibly will federal employees have to combat higher premiums, there could also be higher out-of-pocket costs. You'll need to go to section 2 of the official plan brochure to see if any of the benefits that you use in your plan have changed. That I wanted to talk about. Another thing that I wanted to talk about was, it's kind of related to premium, but it goes a little bit further. It's Blue Cross again. I talk about Blue Cross because I know that 2/3 of all federal employees are in a Blue Cross plan, and I think a lot of folks are going to want to know what's going on with Blue Cross next year. So Blue Cross Standard, the premium's going up 14.6%. This is self and family, by the way. Blue Cross Basic, 15.6%, and FEP Blue Focus, 7%. One other piece of advice we typically give, you want to, if you like the carrier you're in, and Blue Cross has an umbrella of plans, GEHA has an umbrella plans, NALC, MHBP, there's lots of examples in FEHB. If you're happy with that provider network, the in-network provider network, oftentimes that in-network provider network is shared amongst all the plans. It's true of Blue Cross. But you may be over-leveraged. And when I say that, you may be buying too much health insurance. You may be paying for benefits that you're not using. And I think what's really important is for you as a person or as a family to take an inventory of your needs every open season. What benefits are we using? What benefits did we use this year? What benefits do we expect to use next year? Is there any difference there? And then what plan am I in? And is this plan a good fit based upon our healthcare usage? And one thing that I like to do is compare Blue Cross Standard to Blue Cross Basic, because there are differences amongst both those plans, and there's four really that we can point out that are significant differences with Blue Cross Standard. Benefits that you can find in Blue Cross Standard that you can't find in Blue Cross Basic. So out-of-network provider coverage, you get that in Blue Cross Standard. You don't get it in either of the two Blue Cross plans. Mail order prescription drugs, skilled nursing care, and Blue Cross Standard has an IVF benefit of $25,000 annually. All four of those benefits are in standard, not in basic or FEP Blue Focus. Mail order prescription drug is in basic, but you have to be on Medicare in order to get that benefit. So takeaway here is if you're in Blue Cross Standard and you're happy with the in-network providers, and you don't need to go out of network, and you don't use mail order prescription drugs, and you don't need skilled nursing care, and you don't need the IVF benefit, you could save self and family enrollment, I think somewhere in the order of a couple $1,000 just switching from Blue Cross Standard to Blue Cross Basic next year.
Wow.
So I think, I'm generally a glass half full person. I always like to see the positive in something. And generally, when you see a double digit, premium increase, we're thinking that there's not a lot of positives that are going to come out of this for federal employees. This is just going to hit their wallets hard. And it's true. But what I do think it will do is I hope that it really motivates federal employees to look at their current health insurance and do something that most don't do. And that is actually think about switching your health plan and actually going through this process and not just putting on autopilot and auto enrolling in the plan you've always been in. It's actually spending a few hours. Have a conversation with your spouse, if you're married, what are we using? How are we, how's this plan working for us? And then, doing the homework to see if there's a possibility for you to save money in another health plan without giving up the things that you like. Kaiser is one example where if you left a Kaiser plan, you'd lose the relationship of your doctor, and Kaiser is very unique in that sense. But in many other cases, the doctors that participate in Blue Cross, you probably going to be able to find those doctors covered as in-network providers in another health plan. So it's not necessarily true that switching plan means I'm going to have to switch my doctor. That's very important, of course, to maintain those relationships. But I think this is the year to do some real homework. And so I'm hopeful that that is one thing that comes out of this. Only about 5% of all federal employees switch health plans every year. That number, I believe, should be higher. Maybe this year we'll see it higher.
Yeah, I think with premiums going up so much, it will spark people to make more educated choices and consider all the options that they may not have looked at in the past. Are there other factors beyond the huge, premium jumps? In some cases, additional maternal care coverage. Are there any other specific benefit adjustments that stand out in your mind?
Yeah, and IVF, we talked about it a little bit with the Blue Cross Standard benefit, but more to say on IVF for next year. So this year was the year that OPM mandated that all FEHB plans cover all artificial insemination methods, and also that the fertility drugs associated with IVF up to 3 cycles would be covered by every FEHB plan. So was what OPM mandated for this year, 2024. And then they also said, hey, you FEHB carriers, we would like to see you even do more than that. And not much happened, but Blue Cross Standard said, okay, we'll do more. We'll add a $25,000 annual benefit, and the fertility drugs won't count towards that. So Blue Cross Standard this year would pay up to $25,000 of IVF. Now, there still is a member cost share. So, it's not, you still have to pay, I think in Blue Cross Standard, it's 15% out of pocket if you use an in-network provider for an IVF procedure. And IVF procedures are really expensive, anywhere from $15,000 to $30,000. So if you're paying, a 15% co-insurance, let's just, for the sake of easy math, say it was $10,000, you'd still be paying $1,500 out of pocket for that. And so it's still significant amount of money, even when these plans are covering IVF. Okay, but for next year, we have another nationwide PPO that's matching the Blue Cross Standard benefit is GEHA High. And it's basically the same benefit. It's $25,000. The fertility drugs don't count towards it. And GHA High's member cost share is 20% out of pocket. So, but has a lower premium for both self plus one and self and family. So you have to kind of do that math a little bit, and also access to providers. Yeah. And these two plans are the two nationwide PPO plans that have availability for everyone in the country to enroll in and to take advantage. But there's also additional IVF coverage at the local level. So there's DC area plans, for example. All the Care First plans have added IVF coverage. Kaiser plans in the DC area as well as MDIPA. And also there's a plan in Northern Virginia, Centara Health. And there's two new plans in FEHB this year. They're both in California. One covers the San Diego area, that's Sharp Health plan. The other is in Northern California, Western Health Advantage. Both of those plans also have IVF as part of their benefits that they're offering federal employees. The one thing to keep in mind is that these benefits vary across plans. So the Blue Cross standard is 15% coinsurance. There are some of these benefits that go up to 50% coinsurance. Wow. So if we're talking about that $15,000 to $30,000 cost, 50% coinsurance, it's better than not getting the other 50%. But even having to pay that 50% is quite significant. So federal employees will need to look to see what plans are offering IVF in their area. There's others that I didn't mention, but that is one of the bigger benefit changes for next year. More IVF coverage.
Yeah, that's huge for so many federal employees and a pretty wide age range of people. So glad to hear that that's been added. I know there were a lot of people who struggled with finding help paying for IVF treatment, in the last decade or so when I was having my kids. And so it's really heartening to know that federal employees won't have to struggle as much to figure out how they're going to pay for those kind of treatments as they start.
Yeah, and it's kind of a great segue, Love, to another point that I want to make, which is especially true for families that are using IVF. It's nowhere near enough in some cases, but every federal employee should have a flexible spending account. And okay, so if we talk about how we can guarantee to save money, the federal employee that doesn't have a flexible spending account, enroll in a flexible spending account, and you will save money next year. Now, will it completely make up for your higher premium? I'm not sure about that. Depends, how much expected, healthcare usage you can save for in that flexible spending account. But in the case of IVF, probably in almost all cases of IVF, you'll be wanting to max that out. But if you have children that need orthodontic coverage, you're probably also a max out candidate. You do have to be somewhat careful here. There's a use or lose concept that people don't like about flexible spending accounts, and I get it. Why would I want to save money and potentially lose it? I understand that. But I think a lot of folks are able to get a pretty good idea of what the expected healthcare usage looks like. So if we think about dental and we think about vision, and then we think about a typical year in terms of medical, and if we put it all together, we're going to come up with an amount, and there's a little bit of flexibility. I don't think the IRS has updated 2025 totals here, so we're working on 2024 still, but I think it's $3,200 that you can set aside in an FSA, and you can roll over, I think, like around $640 of unused funds if you stay enrolled in the FSA. So if you've never done it before, here's a no-risk way. You'll never lose. Just put $600 in. If you had a perfect year and didn't go to the dentist or didn't have any out-of-pocket dental costs, you could roll over that entire $600 into the next plan year if you stay enrolled into an FSA. They've never been easier to use. They have paperless reimbursement now, pick and choose feature where all of your eligible medical charges are there, and you can choose which ones you want to get reimbursed. And if we're being fair, we also have to say that FSAfeds.gov had some issues this year. They had some fraud in the middle of the year. They actually suspended new accounts from being signed up for a couple of months while they were sorting that out. But they've added new security provisions. They've added some anti-fraud measures. They opened back up enrollments in August. And I think that, there's only so many tools you have to save money. And this is a tool that goes away. Once you retire and you're on Medicare, you no longer, actually, once you retire and you're getting paid via an annuity, you no longer have the ability to have an FSA. So this is really a benefit that only exists for federal employees while they're active and they're still working. And it's a guaranteed way to save money. I mean, you save somewhere around 30% of everything you put aside and pay through the FSA. So only 20% of all federal employees have an FSA. And again, it should be 100, because even if you're in a high deductible health plan where you're not allowed to have an HSA and an FSA, you can still take out what's called a limited expense FSA for dental and vision. So even in that case, you still should get the limited expense FSA and use that for your dental touch your HSA.
This is great information. And folks, I don't think you're going to hear this anywhere else, because within your, HR offices, in your agencies and departments, they're going to forward the information, that comes from OPM about open season, but they're not necessarily trained benefits experts on all the different health plans. It's hard to be an expert in those. And that's what Kevin and Consumers Checkbook really, brings to the table here that you're not going to get at work. So they're going to help you make some initial calculations and focus your search if you use the tool that Kevin mentioned earlier. So use the tool, get a flexible spending account. Kevin, what are the other, kind of must-dos out there?
Yeah.
For federal
Okay.
employees?
I've got another. So two-person families. So this could be a husband and a wife, could be a parent and a child. You have the option to enroll as either self and family or self plus one. Most of the time, self plus one is less expensive, but there's actually, 46 plans next year, where self and family is less expensive than self plus one. It's kind of a weird little quirk of FEHB that sometimes self and family is less expensive than self plus one. So you have to check. And we mentioned already one place to check. It's a good place, and that's the plan brochure. If you go to that last page, that's the rates table. It will show you by enrollment type: self, self plus one, self and family. It'll give you government share, enrollee share. Look at enrollee share, look at self plus one, look at self and family. Enroll in the least expensive one of those. You get the same health plan, the same benefits, regardless of how you enroll. The difference is how much premium you pay. And it can add up to quite a bit. Kaiser High in the Washington, D.C. is an example of one of those plans. You could either save or overpay next year $1,670 if you make the right or wrong enrollment choice. So you have to look at that.
I mean, that's bananas. It makes no sense, right? So thank you for flagging this, because it's one of those things that you might not even check as you're exploring plans.
Yeah, I think this open season, people say it's the most consequential election, in our history, in our lifetimes. I think this open season, I don't want to overuse that, but I think it is really consequential, just in terms, we don't see a double-digit premium increase every year. And this one is really big. And what I'm hopeful for is that, that federal employees will actually look to see if there are plans that offer greater value. I mean, one thing that we've talked about in the past, so we'll talk about again, it's not a plan type that will work for everyone, but a high deductible health plan, really, depending upon where you are in your federal career, could be the health plan that could save you some serious money. And that's just the mechanics of how it works, in that part of your premium goes into a health savings account every month as a premium pass-through. That goes in, and it's available to you to use before the deductible on a high deductible health plan if you want to, or you can choose to invest it. And if your situation allows for it, keep that invested and growing. And if your situation allows for it, to contribute even more on top of that. And the contribution limits for an HSA are double, almost like one and a half, almost 2.5 times of what you can get out of an FSA. And it really can be, an alternate, almost investment vehicle that you can use for any out-of-pocket healthcare expenses, whether you face those today, tomorrow, or well into the future. All of us are probably going to have higher healthcare costs as we age. And when we retire and we make our choice about Medicare, and if we do choose to enroll in Medicare Part B, we can use the health savings account for Medicare Part B premiums. We can use it for long-term care if that's something that we need. And once you turn 65, there are no longer any non-medical distribution penalties, which exist prior to 65. So those go away. So if you chose to use your HSA for something non-medical, you would just pay your normal taxes. So that's also an option with you with an HSA. So if you haven't looked at high deductible health plans, might be the year too to consider that.
Yeah, thank you so much for walking through that. Again, this is information you're really not going to get anywhere else. Again, you guys are such a fantastic resource. Kevin, if folks aren't familiar with your organization, can you tell us a little bit about that as we wrap up?
Sure.
What you guys do and why you do it?
Yeah, so we are experiencing our 50-year anniversary this year of Center for the Study of Service. We were founded in 1974 as a 501c3, and really from the very beginning, a mission to help consumers, especially where the decisions are really difficult and there's a lack of information. And so, FEHB is a brilliant system in that it fosters competition, and if done right, it's going to lower costs, and it's going to increase quality because there's competition in the marketplace. But when you have HMOs and PPOs and consumer-driven health plans and high-deductible health plans, and they all kind of deliver healthcare in a different way in terms of how much you pay up front versus how much you pay when you actually use the service, it becomes difficult to actually compare, an apple to an onion to, two other edible items, but they're not from the same family. And so how do we, it's all something I can eat, but I don't, how do I compare these different things? And that's why, we created this. It's why we provided these actuarial models that are able to rank the plans from least to most expensive off of typical years based upon your family's information. And we've been doing that since 1979. So this will be the 46th year that we've published the Guide to Health Plans. And for me personally, I have been working at Consumers Checkbook. This will be 26 years in about a week. All 26 years, I have worked on this Guide to Health Plans, and I have talked to hundreds, if not thousands, of federal employees and annuitants over these 26 years. And I'm very passionate. I hope that shows through about helping folks make good decisions. And really what we're into is just giving you information. I'm not in the business of recommending plans. We don't really do that. We recommend a process to find you the plan that's going to give you the benefits that you need at the lowest cost to you and help illustrate the trade-offs between different plans, hopefully to help you think about those things on your own and eventually make your own decision. I get asked all the time, what's the best FEHB plan, right? And it's like, I don't have an answer to that because there is not one best FEHB plan for everyone. It's not always the plan that has the lowest cost. It's generally not always the plan that has the highest cost either. It's generally somewhere in the middle, and it's based upon lots of other factors such as what doctors are in that plan. And that helps narrow it down. And then what benefits are important to you that you need? And are there plans that are offering those and plans that aren't? These are the ways that we take, this universe of plans and we limit them down just to the plans that you should be considering.
Thank you so much for what you do to create those models to help us make better informed choices and decisions about our healthcare as federal employees. Really appreciate everything your organization does and stands for and what you personally do to help us make these choices.
All right, love. Thank you so much.